a quick and brief but thorough lead update.
Will do, and this will be very brief. I only have 3.5 slides here. I am joined by Brendan Earl. Brendan is our supervising sanitarian who oversees much of the program that does the lead work at the health department. So quick overview, as you know, no level of lead is safe. It is not a mineral like calcium or iron or sodium that the body has some beneficial use for. Lead compromises the ability of organs to develop properly. It impairs the development of the brain, affects learning and behavior, all of which are problematic. Our rate of elevated blood lead level in Kent County is and has been greater than the state average for a very long time. That's largely because of the older housing stock that we have, our transportation, crossroads, things like that. Some zip codes are disproportionately affected, so this burden is not equally borne throughout the county. Our urban zip codes tend to be more heavily affected. Most lead exposure in Kent County is due to paint and products that were created before a ban went in place before 1978. And so we do see that our overall rates of elevated blood lead have dropped significantly in the past 30 or 40 years. In fact, back at that time, probably a third or more of all children would have had what is now considered an elevated blood lead level. About 10 years ago in Kent County, that rate was about 8% of children. Here in the past few years, it's down less than 4%. So this is actually a great public health and public policy victory that we are seeing these rates drop consistently. However, we still have a problem with EBL, elevated blood lead, and great disparities remain. While we're overall seeing a lower trend, some of our zip codes continue to see rates that are 10% or higher with children having elevated blood lead levels. And so you, our Board of Commissioners, along with other community leaders, have consistently affirmed that it is a priority for all of us to protect all of our children from lead exposure. Last year, a lead action team was announced about exactly 1 year ago that would take the recommendations of the lead task force and other evidence-based practices and put them into action. Unfortunately, a once-in-a-century pandemic hit a few weeks later, and so the plug was pulled on a lot of those activities. However, many things did continue to happen, and we are resuming many of those activities now. And so I want to share with you an infographic that Lori and the team has created showing some of those numbers. And I'll briefly ask Brendan to go over these numbers. Brendan?
Yeah, thanks, Adam. So we, since December 2019, and that's the reason that date was there is because that was when we'd received funding from Kent County to hire 2 original lead sanitarians. That's when they were fully trained and started their work. So since December 2019, we have ongoing or completed 161 investigations on properties throughout the county. These include everything from site visits for lead inspection risk assessments, a new service we have called a home health screening that looks at not only lead but other housing issues. So they could include things that have been abated or things that are in enforcement. So we're dealing with or have cleared 161 properties, which I think within a year, considering the pandemic, is a pretty good achievement. Out of those 161, 81 of those came off our multiple EBL list that was developed by the lead action team. They had identified 427 properties, and we within this year got to 81 of them, which is a little less than 20%. Included in the 161 properties that are being investigated, we did 57 site visits. Again, like I said, they could be include several different types of inspections, from lead inspection risk assessments to just risk assessments or home health screenings. We have cleared 39 properties, and that includes 28 properties that have been remediated and abated. So either the 39 properties that we found no lead hazards, or they were taken care of through corrective actions. And then also within these investigations, we've only had to do 5 enforcement activities. So Out of the property we've looked at so far this last year, we've only had to go to enforcement 5 times. And out of 161 properties, I think that's a big accomplishment. That means that the lead sanitarians that we have try to use education and help residents find financial aid to take those taken care of, so that we've only had to go enforcement 5 times, which is like 3% of the cases that we've looked at. And finally, through this last year, despite the pandemic, we were able to fully staff our lead team, and that includes 5 lead sanitarians, a health educator, and a lead clerk. So despite a lot of the hurdles we faced because of the pandemic, things that included, 1, the shutdown where we couldn't do site visits. 2, with the pandemic, people didn't want us in their houses, which, I really don't blame them. We were able to get the proper PPE to continue with our work. And we've had a lot of problems with things like, for the abatement activities, people can't get windows. The factories have them on a real big time delay, or we can't find contractors to actually do the work. So despite all these hurdles, I think we have accomplished quite a bit this last year. And I'm really looking forward to seeing what we can do this coming year when we have a lot of less restrictions on us.
Thank you, Brendan. And Brendan will be available here in a moment for questions if you have specific questions about the program. In conclusion, we are staffing up that lead action team once again. This was created a year ago with a mission of ending child lead exposure in Kent County, and is a partnership between the county, the city of Grand Rapids, and many other stakeholders in our community. There is a strategic plan for this lead action team on accesskent.com. I would encourage everyone to take a look at that. That strategic plan has 5 goal areas with specific measurable objectives. Each of those goal areas has a work team. Those 5 work teams are the creation team, which is responsible for assembling and populating the other teams and facilitating and leading this through a steering committee. A clinical care team with objectives to assure every child has appropriate care from a provider. An environmental health team, reducing risks and hazards in the environment, the work that Brendan is describing. A social supports team, working with these affected families to make sure they have the services and the resources, the referrals to improve their outcomes. An opportunity team, looking at policy development ideas, awareness, advocacy, looking for opportunities for collaboration, perhaps grants and other funding opportunities. The lead action team will be posting a report quarterly on accesskent.com. We will be sharing it with the Community Health Advisory Committee and with other groups such as this one. You should look for that first report no later than the second quarter of this year. And again, more information can be found on the county website following the links to lead. So that's all for this update. Any questions for Brendan or me?
I just want to say, wow. I mean, I am just so impressed that we were able to do that work with all of our challenges this year. So that is awesome. I also wonder if we can get that second slide with those numbers, if we could possibly get that slide on social so that we could all post that and share that good news. That would be great. Any questions today?
I have a question, Chair Bolter.
Sure. Go for it.
All right. So I noticed, you said 39 homes were cleared, whether, they had lead abatement or remediation. Is there a reason to go back to any of those homes with maybe, the thought of a reoccurrence, with, if windows weren't replaced or, lead paint wasn't, are those fully, abated homes?
Yeah, that's a good question. Usually it depends on what kind of program financial aid they qualify for. So ones that go through the CHIP program, which is a partnership between us and the city of Grand Rapids, those are fully abated. I mean, windows were replaced, siding was replaced, so we're not going to go back to those. Sometimes they do go through something with Get the Lead Out, where they'll use what we call interim control measures, and those are ones we'll put on a list to as like a monitoring list to make sure. Supposedly a lot of the interim control measures, like the special lead encapsulating paint, are said to last 25 years, with some of these houses, we're not quite sure yet because we're seeing some repeating customers coming back from like the 2009, 2010 period. But that's something we will monitor. We have them on a kind of a list to revisit.
Okay, thanks. And like, Commissioner Bolter said, awesome job. I'm so happy that we were able to complete, what you guys did in that amount of time with the circumstances. So congratulations.
Thank you. I
Commissioner
really
Skaggs?
appreciate it.
Thank you, Chair. Yeah, I just want to echo the leadership that Chair Bolter has made on this, and then Commissioner Breevy for leading up the task force and all the staff for working on this. My quick question is, obviously we had the pandemic get in the way of making all of the numbers that we probably wanted to make. What are our goals for a post-pandemic year? What would that look like? How many visits, how many mitigations, et cetera?
Well, first of all, I'd say that we really want to get back to the objectives and the measures that are in that strategic plan, the lead action team report. Brendan, do you want to talk briefly about how many you think you could get to in a year if you had your staffing available for the entire year, and if you didn't have prohibitions against making home site visits?
Yeah, I would guess. I mean, we literally didn't do any work. I'd say for 4 straight months. So I would say I expect that number of 161 to be at least a third higher, and that's not counting people who didn't want us in the house. So I would fully expect to have at least over 200 properties next year. The one thing I am hesitant to guess about is the actual ones that are cleared, because again, a lot of that abatement requires on material availability and contractor availability. And the number one hurdle we are having now is getting subcontractors who want to do the remediation work, because one, they can go in the private sector and make a lot more than remediating homes, and two, they have to be certified as lead safe workers. And the biggest thing is that if I can go in the private sector and make more money with all the home construction, why would I want to take a job that pays less and then has the oversight, associated with it? So either by us, the city, or the state. So I would expect, I'm hoping for between 2 and 225 houses at least to be investigated. I think the biggest hurdle is the actual remediation due to the contractor shortage.
Okay, so we could overcome that potentially if we had the funds to to be more competitive in the marketplace.
I think that's the number one issue is that, yeah, we have set prices. So if a contractor replaces a window or door, that's a set price, as opposed to like going out and them quoting us for the job like they would in the private sector.
And then do you have a sense of how many of these houses are owner occupied and how many are rental properties?
Yeah, I do. I would probably say a majority, I'd say about 2/3 probably are rental properties.
Okay.
And we generally have more success when it comes to rental properties, especially because one, a lot of our programs deal with people on Medicaid, and generally those are a lot of the rental properties, like Section 8 housing, stuff like that. The ones we come into the homeowner occupied are some of the ones on the multiple EBL list that were previously rented. Now they're owned by a homeowner. So, and we try to, no matter if they're homeowner or rental situation, we try to find them the correct financial aid so they're not bearing the entire cost of remediation or abatement.
Great. Thank you.
Any other questions
Thanks,
on lead before we move on?
Sure.
Thank you, guys. That was awesome work. Such a positive report. Thanks so much. We really appreciate all your work on it. Great.